You're looking at innovations, you're looking at technology, you're looking at quality, you're looking at sustainability. But also we're looking at patient-centered health services. Technology may simply mean a different way of doing something. You may change medicine to treat a particular disease. That is in itself, you have made a change in technology. But we are also discussing in the context of a very challenging environment, especially in the field of HIV. As you may know, currently a lot of funding for HIV is from the American government, from PEPFAR, and you know the challenges that came with the executive order issued out by the US President, putting a halt a bit to review the foreign assistance. 50% of what we see as donations to these facilities are funds for vertical programs for HIV, TB and malaria. Over 50%. Actually at one time it used to be 70 to 80%. Now it is over 50%. So when you look at the donation, the section of donation, more than 50% of the donation for TB, for HIV, TB and malaria. Now the other one remaining, like 40-something%, are just monetized, sometimes services. User fees being paid by other patients cannot be taken to replace the financing for HIV that was coming from the donors. So how do we handle that?
We need to be able to strengthen disease prevention so that we can be able to do early screening, problem early identifications, but also change behavior for people to seek services much more early. If you looked at the figures in government, that 40% of our outpatients are due to malaria, which also happens in the health, the PNFP1 subset. 40%. 20% of the admissions are also due to what? Malaria. 10% of the deaths which occur in our health facilities are also related to what? Malaria. And so that's why I come with the message that now Uganda is one among the 19 countries which is rolling out the malaria vaccination. So we need to be able to see that how can we be able to embrace this.